Why would a religion decide to place limits on the medical treatment you can receive? Today we're going to examine the question, would it be wise for a Christian to consult a mental health professional? But not from my personal opinion, rather from the Watchtower's own publications. Is the way the Watchtower handles this issue irresponsible, or am I just exaggerating? In this video, we're going to review what they themselves have written, so there's no doubt about the seriousness of this matter. Before we begin, if you're new here, let me tell you that the voice you'll hear has been generated with artificial intelligence. However, the content doesn't come from an automated system. It has been written entirely by the creator of this channel. You can call me Nowachi. Let's get started. When you want to know the Watchtower's point of view on a particular topic, the best thing you can do is check the most recent Watchtower Publications Index. In this case, it's the 1986 to 2025 index, and you can find it in the Watchtower's online library. Now, you look alphabetically in the subject index for the topic mental illness. Then we go through the subtopics until we find exactly what we're looking for. In this case, Christians who suffer, should they seek professional help? Here, the information appears in 3 publications. Each title is given in abbreviated form, but you no longer need to memorize the meaning of each abbreviation like in the old days. You simply click and it takes you to the publication you want to consult. In this case, there are 3. The first is the 2023 public edition of the Watchtower, page 4. The second is the September 1st, 1996 issue of the Watchtower, pages 30 and 31. And the third is the October 15th, 1988 issue of the Watchtower, pages 27 to 29. Now let's take a look at the publications. The first 2023 issue of the public edition of the Watchtower isn't the best source for going deeper into this topic, since it's not intended to give instructions to baptize Jehovah's Witnesses. Its purpose, as the name suggests, is to appeal to the general public. I encourage you to read it for yourself. But basically, it says that if you've had serious or prolonged symptoms, you should consult a mental health professional. And here's where several questions come to mind. What exactly does serious symptoms mean? What if I know something's not right, but it's not that clear? Or why shouldn't I go if I've only had mild symptoms for a short time? In just a moment, you'll understand why I'm asking these questions. Other than that, the rest of the article says that mental illness is not a sign of weakness, which is fine, and adds that prayer and the comfort of the scriptures can help. In short, it's a message designed for people outside of Jehovah's Witnesses. However, the main course comes when we examine the September 1st, 1996 issue of the Watchtower, pages 30 and 31. This article explicitly raises the question, would it be wise for a Christian to consult a mental health professional? And not only that, it appears in the questions from readers section, where several important doctrinal changes have been introduced in the past. So now we're looking at truly relevant information. Let's begin the analysis. From a critical thinking standpoint, the first thing I ask myself is, why is a religion even posing this question? Why is a religious organization getting involved in the medical treatment I should choose? Shouldn't a Christian, or anyone, for that matter, be free to decide their own medical care? And even more importantly, do the leaders of a religion have the training and knowledge necessary to give opinions on medical treatments? I encourage you to look up and read the full article. For my part, I'll be pointing out some important paragraphs. Let's start with the first gem. In some places, it has become quite fashionable to seek therapy. In many cases, the patient does not have a severe mental disorder, but has difficulty coping with some situation in life. However, it is the Bible that gives the most effective help in handling the difficult problems of life. Through the Bible, Jehovah supplies wisdom, thinking ability, and true knowledge, things that fortify us mentally and emotionally. Now, I think we can agree that it's not a good idea to go to the doctor just because it's fashionable. But here, the Watchtower oversteps by setting the first limit. Only seek medical help if the mental problem is severe. If it's not, then, according to them, the Bible is the solution. And here's where the trouble starts for the Watchtower. Why should a religion decide the moment when I ought to seek medical help? Who determines what's severe and what isn't? Let's keep soaking in the wisdom of this great Watchtower article. James 5 verses 13 to 16 encourages such ones to call on the elders for help and counsel. A Christian may be spiritually sick, or he may be distressed by an unchangeable circumstance or by oppressive stresses, or he may feel that he is the victim of injustice. Such a person can find help with the elders. Here's my question. How is an elder supposed to know whether it's a spiritual problem or a mental one? Does the elder have the necessary training to distinguish between a spiritual issue and, for example, a neurochemical dysfunction? The answer is obvious. He doesn't. So why not let the patient see a mental health professional whenever they wish? If they want to go to the elders too, fine, but they shouldn't skip seeing a doctor. Why should that be incompatible with a Christian faith? Then, our well of wisdom goes on to say, what, though, if a person's mental distress and confusion persist despite the skillful help of spiritual shepherds? Some in this situation have chosen to undergo a thorough physical examination. A physical problem may lie behind emotional or mental distress. Treating such a problem has in some cases given relief to the emotionally ill person. Wow, such wisdom. Look, gentlemen of the Watchtower, this is done not because you say so or advise it to your flock, but because it's part of medical protocol in practically every part of the world. So, really, it seems more like you're saying there need to be more hurdles before someone can go to a mental health professional. Let's see how the Watchtower keeps stacking bricks between the patient and the mental health professional's office. There are also different kinds of mental health practitioners. Among them are analytic psychotherapists and others, who may delve into the patient's personal history to try to find reasons for irregular behavior or painful emotions. Behavioral psychotherapists may try to help the patient learn new behavior patterns. Some mental health practitioners believe that most mental illnesses should be treated with drugs. Reportedly, others recommend diet and vitamins. Now, this paragraph was either written by someone who has no idea what they're talking about, by someone with scattered information they can't organize, or by someone deliberately trying to confuse the reader into thinking that medical science has so many different treatments that it doesn't really know what it's doing. What the reader actually needs to know is this. In general terms, there are two types of professionals who treat mental health issues. On one hand, there's the psychologist who studies between 4 and 5 years, depending on the country, to earn their degree. Psychology has several branches, but if they want to practice psychotherapy, they must complete a specialization or master's degree that lasts another 2 to 3 years. In total, around 8 years of training. Something key to keep in mind is that psychologists cannot prescribe medication. Their work focuses on assessing, diagnosing, and treating emotional or behavioral problems through psychological therapy. On the other hand, there's the psychiatrist who first studies general medicine for 5 to 6 years, then specializes in psychiatry for 3 to 4 years, adding up to about 10 years of training. As a medical doctor, they can prescribe medication and are trained to determine whether a mental health problem stems from a biochemical imbalance in the brain or from other factors. Today, thanks to science, we know that the root of many mental health issues lies in neurochemical dysfunctions, and only a psychiatrist, not a psychologist, can evaluate and treat that. In addition, psychiatrists are trained to combine the use of medication with psychotherapeutic interventions, either providing them themselves or working together with a specialized psychologist. As I said, the author or authors of this Watchtower paragraph seem to want to give the impression that there are many types of therapies and that each professional just does whatever they can according to their own knowledge and judgment. Nothing could be further from the truth. Psychiatric treatment is regulated by official clinical guidelines issued by professional associations. Although each country has its own associations, most follow the recommendations of the American Psychiatric Association or the European Psychiatric Association. And this is where the average Jehovah's Witness says, "My Aunt Linda went to a psychologist and ended up crazier." Friends, let's understand something. Science is one thing, and clinical practice is another. Scientific studies, conducted with representative samples and rigorous protocols, are highly reliable and available for other researchers to review. By contrast, applying those findings to an individual patient, what we call clinical practice, is an art that depends on the skill of each professional. That's why it's perfectly valid to seek a second or even third opinion. Then there's the other witness who says, "My neighbor is a psychiatrist and has been divorced twice. I'm not going to see someone who's worse off than I am." First of all, I know you love judging other people's lives with a sense of moral superiority, but the truth is, you don't know the personal reasons someone might have for making decisions in their life. Second, a medical specialist is, above all, a human being like anyone else. And if we're going to judge someone's private life as a measure of their professional credibility, I could also tell you plenty of things about the governing body that wouldn't put them in a very good light as moral individuals. Yet you let them guide you spiritually. So why apply such a strict standard to a psychiatrist while giving your governing body such a lenient one? Now get ready, because here comes the most infamous and manipulative part of the Watchtower article. Significantly, Professor Paul McHugh, director of the Department of Psychiatry and Behavioral Sciences at the Johns Hopkins University School of Medicine, said that the mental health profession is a rudimentary medical art. It lacks easy access to proof of its proposals, even as it deals with disorders of the most complex features of human life, mind and behavior. This situation leaves the door open to eccentricity and fraud, as well as well-intentioned treatments that may do more harm than good. Now, if I were a Jehovah's Witness predisposed to believe what these men write, I'd walk away thinking there's no point in going to the doctor for a rudimentary and probably fraudulent treatment. But let's read this critically. It's clear this paragraph is designed to discourage visiting a mental health professional. It's essential to note that they quote an expert in psychiatry to discredit psychiatry itself, but they don't provide the source so it can be verified. In the academic world, that's a clear sign of bad intent. The Watchtower has already had to face lawsuits for misquoting sources. And I'm not just talking about old cases like the well-known creation or evolution controversies. Take, for example, the more recent scandal from the May 2021 Awake. Number 3, in which a scientist sued the Watchtower for misrepresenting what he wrote. The outcome? They had to remove that paragraph from the electronic version of the publication. Now imagine what happens when they don't even give a citation. Sorry, but without a source, this statement has no validity. Period. Then they say this opens the door to all kinds of fraud. As we've already seen, there are authorized treatment guidelines that professionals follow. This is an attempt to confuse readers. Of course, there are quacks, but if you really want to guide your readers, teach them how to tell the difference between a professional and fraud. The person I'm going to consult has a psychiatry specialization certified by the competent authority in my country. Can you explain to me how the treatment they're offering is supported by current medical guidelines? This tactic of discrediting whatever doesn't suit them is an old Watchtower practice. When they didn't agree with vaccines or with organ transplants, they said horrible things about them, and you ended up thinking the transplant would harm you more than the illness itself. They even claimed an organ transplant could change your personality. They do the same with blood transfusions. And of course, unlike scams, a serious treatment will always have pros and cons. But these manipulative legalists love to exaggerate the cons and minimize the pros when something doesn't align with the current leader's ideas. Honestly, they're not just irresponsible, they're malicious. And now, the crown jewel. In the next part of the article, they let us see their true intentions. It will be dangerous to consult a mental health professional who does not respect the governing body's interpretation of the Bible. Oh no, sorry, our religious and moral convictions. Many Christians are striving hard, despite mental and emotional confusion, to have the same mental attitude that we have instilled in them through manipulation. Oh no, sorry again, that Christ Jesus had. Such are rightly concerned about the attitudes of anyone who might affect their thinking or behavior. Some practitioners view any restrictions imposed by scriptural beliefs as unnecessary and potentially harmful to mental health. They may approve, even recommend, practices condemned in the Bible, such as homosexuality or marital infidelity. So basically, now they're portraying mental health professionals as immoral villains out to corrupt us. What filthy tactics from this sect! No, my friend, The first thing a psychiatrist is going to do is recommend a good treatment that will probably help you a lot. Let's break this down. In the training of a mental health professional, respect for local culture is included. This means respecting the patient's religious beliefs. But if, for example, a mother is depressed because she wants to be faithful to the governing body's instruction not to speak with her disfellowshipped son except to invite him to meetings or for strictly necessary matters, the most likely outcome is that the doctor will help her understand the real reason for how she feels and guide her to explore, on her own, a way to come out of that depression. On the other hand, if a young Jehovah's Witness who is gay feels like a worthless person because, no matter how hard he tries, he is not attracted to women and has fallen in love with a male coworker, the psychiatrist is not going to tell him his feelings of self-loathing are valid. Would that help the patient? A psychiatrist who did that would risk losing their license. Their obligation is to follow the medical guidelines of their profession. Because, let's be clear, science is science. There can be no valid scientific knowledge if every step had to be cleared with religious leaders. If that were the case, there would be one science for Buddhists, another for Hindus, another for Christians, and another for Pastafarians. It's the same reason modern governments are secular and do not adapt laws to what a specific religion dictates. Of course, religious leaders would love to control science, just as they would love to control government. And no, Jehovah's Witness, if you're heterosexual, the psychiatrist is not going to send you to a gay bar so you can experiment. And if you're depressed, they're not going to tell you, look, friend, what you need is to go to a brothel to cheer yourself up a bit. A psychiatrist will not suggest anything you haven't put on the table yourself. So, to conclude, why is the governing body of Jehovah's Witnesses so afraid of mental health professionals? The answer is simple. Because these professionals are trained to help patients identify the true causes of their distress. And in that process, there's a high probability the patient will discover that the root of their problem is precisely their beliefs. My friend, the governing body couldn't care less about your mental health. The only thing they truly care about is that you remain loyal to them. Let me ask you something. Do you want this content to reach more and more people who need it? It's very easy and it doesn't cost a thing. Just subscribe, hit the notification bell, leave a like, and share this video with anyone you think it could help. Thank you for being part of this project. See you soon.